If you're suffering with a low thyroid, hypothyroidism, and maybe you're taking your medications, they're not necessarily working for you to make your symptoms get any better. Yes, your blood work could be looking fine. This video is for you. So let's go through some of the most commonly prescribed types of medications for a low thyroid. The first one, levothyroxine or Synthroid, is a man-made T4, so your thyroid hormone T4. Now the Armour desiccated thyroid is usually a pig glandular, so from pigs, and that's supplying both T3 and T4. And for a lot of people, this might work a little bit better. It's a little bit more natural. However, because we have feedback loops to the thyroid gland from the brain, this becomes important because as much as your blood work could be back and normalized in the normal range because you are consistently taking your thyroid medication, it doesn't necessarily mean that your thyroid function itself is improving, or more importantly, that the brain function is improving as well. And this can be related back to some other hormones, some of which I talk a lot about, like leptin resistance. So if you don't know what that is, if you've got leptin resistance, now unfortunately, that's going to cause an increase in something called reverse T3. Now reverse T3 is going to counteract that proper conversion of your active thyroid hormone, your T4 to your T3, and this will also have an effect on your cortisol levels and something called pregnenolone steal. So this is something that, again, as much as taking medications you may think it's working for you, not necessarily. You always have to support these other bigger picture symptoms and functionality of your brain, your leptin signaling, and I've got a lot of videos on leptin resistance and how to fix that, getting back in tune with nature and the proper clock and timing mechanisms of your brain, as well as your thyroid, becomes very important, as well as all of the other clock mechanisms in all of your body cells as well. So to learn more about that pregnenolone steal and are your cortisol levels high because of this, I want you to check out this video. I'll see you there.